Happy Friday! This is Dr. Bridget Young from babyformulaexpert.com here for happy hour on Friday, and we are going to be talking about skin to skin, realistic skin to skin for real moms, what it might do for you, if you should be trying to work it in, and how to get it in. The kids are here. I'm sure you can hear them. I got the ergo locked and loaded, Nook, so I'm sure Vaughn will appear at some point. Hey, gentle, gentle. So, skin to skin. Here are the reasons I most often hear why moms are not doing skin to skin or think that they should not or don't need to be doing it. One, I did it in the hospital, as in, it's cool, like right after birth. It's awesome right after birth. But then the idea that it's not really helpful after that, or it's only helpful for like super fresh babies in the hospital, but then not so much. Or I'm formula feeding. So the most we read about skin to skin is how helpful it is for breastfeeding. It's true. Skin to skin is super helpful for breastfeeding. Okay, honey, finish your milk and then you may have some. Vaughn, oh my gosh, I'm sorry. Vaughn, please don't touch that. So I'm formula feeding, so there's no benefit in that for me. And then, oh yeah, the biggest one, which is me, I don't have the time to do skin to skin. And girl, I hear ya. So if you meet with a lactation consultant, not to be insulting, I am one. And early on, we always say, myself included, try to get an hour. Just curl up in bed with your baby, put them right on your chest, relax together. Take it as a time to catch up on a show or have a nap, read a book. And that sounds amazing. But I have stopped telling women that because now that I am a mom myself, I can see the glaze over look like, that's not going to happen. Who do you think I am? I don't have an hour to lie in bed. I have things to do, like all this laundry, or God forbid you actually have another child who needs you. There's no way you can lie in bed for an hour just relaxing with your youngest baby. It just does not happen. Fun time. So I'm going to break down for you the reasons why you should be considering doing skin to skin even if you are exclusively formula feeding. And then I've got some tips, professional and personal tips about how to actually get it done in the real life world. Like if you had a trust fund, lay in bed for an hour. That sounds awesome. If you got like a job or another kid, here's how to do it. So this is the biology of skin to skin and why it's so awesome. I'm going to skip the entire breastfeeding component, which is huge, but there are awesome resources, endless blogs on the internet about why skin to skin is so great for breastfeeding. So if you're breastfeeding, look that up. You'll have tons of resources. If you are not breastfeeding, and if you never intended to breastfeed, skin to skin is still really awesome and can have a lot of benefits. So one, I didn't even say what skin to skin is, but I'm sure you got the baby all nude in a diaper on you, all hippie braless, so your skins are touching. One, when the baby is that close, the baby can really smell you. Infants have a really heightened sense of smell. We have research to show that infants can distinguish their breast milk from another mom's breast milk. Just the kids are so loud, I'm sorry. There's nothing I can do about it. At least they're not crying. So having them like right up in your business lets them smell your pheromones, like the little subtlety to your natural scent. And one, not only does that calm them because they know you, but it allows them to really bond with you even more. Parents who have adopted a newborn, this is a fabulous way to help your newborn get to know you and bond with you. The other really awesome biological parts about skin to skin that apply to all parents and newborns is when you have them naked against your chest and moms in between your breasts, even if you're not breastfeeding, you're doing two things for them. One, they're able to hear, feel, and sense your heartbeat. And that natural biological rhythm helps them keep their own heartbeat consistent. And in a very similar way, obviously, it's really warm in there. Again, even if you're not breastfeeding, your breasts kind of cradle them in. Your body heat keeps them warm so that their own body doesn't have to expend energy doing so. So newborns have a lot, well, all of us expend a lot of energy breathing, staying warm, but this is a really big deal for newborns because in utero, they didn't have to do any of that. Then they come out, they don't have higher order cognitive thoughts, but it takes a lot of their brain power and their energy to simply stay alive, like keep their heart beating, remember to breathe kind of a thing. So when they're on you like that, you are literally taking work burden off of them. PD, that's good use of your words. So because you removed some of this work from them, PD, you have plenty. Let him play with one. Because you've removed some of this work from them, they can truly relax in a way that they're not, like even if they're just napping by themselves, if they nap on your chest doing skin to skin, it's a deeper relaxation for them. Again, because they don't have to expend energy keeping themselves warm, regulating their respiration, regulating their heart rate. So one, it allows them to get this special deep rest, and that also allows them to bond with you because they associate your smell, that warmth. I'm sorry. All right, hey, Petey. No, you may let him play with something. Here's his juice. Come on, here you go. Thank you very much. I'm sorry. So it allows them to get this deep, deep, deep relaxation, and then they associate that with you, so it's a very biological-based bonding. Also, just warm and cozy to have your baby in there, so that's a very emotional bonding for you, too. Okay, so who should consider skin to skin? Those reasons are enough to suggest that any parent, daddies included, of a newborn should try skin to skin. Who might especially benefit from it are what I call the agitated baby. If this type of description fits you and your baby, PD, my first, was totally this way. They're a little bit on edge. Like they may have an overactive startle reflex, or they're very sensitive to stimulation or noise. You know, they're kind of jumpy. That's very normal. I personally think some babies' neurons are just a little over or underdeveloped at birth, and so they're just a little overly sensitive. Skin to skin is really helpful for these babies because not only did it take all of that work away from them, but it's a little bit like sensory depriving, but very safe and cocooning. So it can really help those babies calm down. Those babies, you know, tend to be a little bit more fussy. So any kind of fussy baby at all, colicky baby, in newborns, these are all related symptoms, will really benefit from it. The sick baby, if you're breastfeeding, you know that having them on your skin allows them to transfer germs to you so you can make antibodies. But even if you're not breastfeeding, if your baby is ill, again, having them there, you're taking some of their load off of them so that they can devote more energy to fighting their infection. So it can be really helpful to help them devote energy to healing and also get that really deep, restful sleep they need to heal. So doing skin to skin with your newborn when they're ill or have a little cold can be really helpful. And I also mentioned the adopted newborn specifically. Whoa, hey, Vaughn, I asked you not to play with that. People don't think of doing skin to skin with an adopted newborn because, of course, you're not the biological parents. But all those reasons I just described, you can see how that might really help a new baby be able to bond with non-biological parents as if they were so. So it can be a really beautiful thing. That brings me to the point often you hear like, oh, my baby's too old. So there's a lot of, kind of debate about how old is too old to do skin to skin. I've heard some experts say as late as 24 months. Now, I personally think, especially if you haven't been doing skin to skin consistently and you try to throw your naked toddler on your naked breast, that is a recipe for disaster and probably sore nipples. So, these numbers I'm totally making up for myself, so ask your doctor. Any newborn, for sure, at any time. And I would say really any time up to about 6 months, if you've been off the skin to skin, you can go ahead and try it again. And a little bit of that, like for 6 months old, it's going to depend on your baby's temperament. If you've got like a rowdy, wild 6 months old, they're not going to just lay there and relax. But they may. It totally depends on temperament. At any time up to 6 months, that's still a really young baby, and they would benefit, and especially in one of those scenarios I said, like it's a jumpy baby, your baby's sick, go ahead and try it, even if it's been several months since you've done skin to skin last. Okay, let's get to the good stuff. The real practical tips about how to do skin to skin in the real world, and especially if this isn't your first baby. The first is to try to actually dedicate an hour in a fun way. So I actually was lucky enough to be able to do this with my 2 kids, but actually put a date night on the calendar with your hubby or your partner, and you know, after the other kids are in bed, you have the date night in bed. You take up a bottle of wine, the laptop, and you put on a movie, and you do skin to skin. So it's a little less romantic. It's more like a threesome, but your life's like that anyway now. So mom gets to do skin to skin with the baby while you guys are enjoying a movie together. So that can be really, and then, I don't know, it's just really bonding. Have dad switch back and forth and have dad do a little skin to skin, then mom do a little skin to skin. So that can be really, really fun. And then the other way, hey baby, the other way to do skin to skin in the real world is to just do it while you're getting other crap done. So get yourself a baby carrier. I'm sure you have one that the baby is directly against you. So I'm into the Ergo now, which I have because I thought Vaughn was going to be fussy. So you guys know the Ergo, the baby goes in here and then this thing comes up over them. So it's just the baby against your clothes. Hey, PD. Really, any of the cloth carriers are fine. Would you like to say hello? Like the Moby wrap or any of those, a Mai Tai wrap. You want to say hi to everybody? That's very cute. Anything where the baby sits directly against you is great. So you get yourself hippie and all, bra free, get the baby down to just their diaper, put them on you, put them on the wrap, and then get your husband's button-down shirt, or I got a hoodie I wore when I was huge and pregnant, so it still zips up over both me and Vaughn. And you zip yourselves up, and then you go about your dang business. So you're like washing dishes, doing laundry. The baby will probably fall asleep. It's nice to do this around nap time. I know I'm wearing earrings. Because skin to skin usually makes them tired anyway. It makes them relaxed, and so then they fall asleep. So that you can get all other stuff done while you're just walking around without a bra and with your baby. That's silly. It's going to give you some funny feelings. You're going to feel half like Xena, warrior princess who can do anything and cancel the world. Like, I can do skin to skin and wash dishes. That's going to make you feel weird, like Silence of the Lambs, walking around naked with your baby. But that is modern motherhood. So, and it really, really can help. So I love recommending skin to skin, especially, so I work with patients and clients for any kind of breastfeeding issue. But even again, if you're formula feeding and your baby's ill, or the other perfect time to do skin to skin is when you have an overtired baby. So you know how sometimes babies go through these phases, they might have gone a whole day only napping an hour or something, then they're overtired and they're crazy and cranky, right? But they won't fall asleep. Skin to skin can be really nice. It's like a reboot button. It's like holding down the power button on a computer, I swear. Especially for newborns, I would say like in the first 2 months, it usually works like a charm. So if you don't have time to lie in bed for an hour after one of those days to sort of reset your baby, do it while you're getting other stuff done. I have taken a walk doing skin to skin. I mean, zipped up, nobody knew, but I knew. And it sure did help the baby. So try that. Those are my tips for getting it done in the real world. And I wish more people would talk about ways to do some of this really awesome stuff in a real life scenario, because moms are busy. I get it. And Petey gets it too. Right, Petey? Yeah. So if you know someone who has a newborn, especially if their newborn's having some issues like all newborns do, please share this video with them, because I think it can really be helpful. Especially, like I said, God forbid, if you have a cranky newborn and it's your second kid, so you don't have any time to do skin to skin. Well, you do. There's ways to work it in. Okay. I better get going. Yeah. Speaking of babies. So again, this is Dr. Bridget Young from babyformulaexpert.com. Oh my gosh, Sabrina, hi. My dear girlfriend is watching. If you like this video and you have another question you would like me to answer or an issue to talk about at some time, Petey, honey, please, I asked you not to touch that. Go ahead and send me a message, leave it in the comments. Hey, that's one. And I will get to it on the next happy hour. Peter, that's two. Okay, it's time to go in case we hit 3 and need to do a timeout. Okay, you guys have a wonderful weekend. I really hope that was helpful. And again, share this with somebody who may have a newborn and you think might benefit, because having a newborn is hard. Okay, I'll see all you guys next week. Have a wonderful night. Bye.